The baseline isometric test on the lumbar extension machine is conducted in 6 stages. These stages include the patient greeting and introduction, machine setup, the dynamic warm-up exercise, the practice isometric test, the baseline isometric test, and interpretation of the test results with comparison to the patient's age and gender-matched norm. Before starting the isometric test, the therapist will calibrate the machine. To do this, go to the calibration menu and select Calibration Update. To set up the machine, loosen the chain, set the angle selector to 18 degrees, and unlock the counterweight. And make sure that the movement arm lock is in the up position. Follow the wizard, select Next, and bring up the calibration values. Prior to beginning the baseline isometric test, it's important that the therapist introduce themselves to the patient and explain the overall test procedures to them. It's also important to ask them to empty their pockets and remove their belt if they have one on. Make sure you ask if they need to go to the restroom before you start the procedure and if they've performed their warm-up activities. As you invite the patient into the machine, instruct them to move their hips back against the pelvic restraint. Explain to them why the restraints are necessary. Then go to the computer system and enter them in as a new patient. Go to the patient menu, select the option New, then enter their first name, their last name, their height in inches, their body weight in pounds, their date of birth. Be sure to designate whether it's a male or female patient. And to save the file, click on the Save button in the lower right-hand portion of the monitor. Now, determine if the patient needs a seat pad in the machine. Ask them to take their thumbs and point to the top of their hips at the iliac crests. Look to see if where they're pointing is aligned at the center of the pad or above. If not, ask the patient to step out of the machine and apply a seat pad. We have 2 different types of seat pads, a thin one and a thick one. Once the patient returns to the machine, again check the restraints and ask them again to point to their iliac crests. Now, the next step is to adjust the headrest. Move the headrest up to the base of the skull so that the patient is positioned comfortably back against it. Then adjust the femur restraints. The femur restraint pads should be brought up over their thighs, and the height of the femur restraint should be determined. Begin with the assumption of 4 or 5 for women, 5 or 6 for men. And finally, ask the patient to secure the thigh restraint across their legs. Now remove the slack from the thigh restraint with the thigh restraint adjustment. And then bring the femur restraint up over their legs and ask the patient to hold the pads. And then instruct the patient to bring their feet out on top of the footboard with their heels at the bottom and their toes turned inward slightly. As you're adjusting the footboard, watch for compression in the femur restraint pads because this will tell you how tight they are becoming. And finally, tighten up the thigh restraint. Check the restraints by asking the patient to lift their heels off the footboard and to bend forward and touch their toes. You're looking to make sure that the pelvic restraint pads do not rotate and that the patient cannot lift their heels more than 1/2 inch off the footboard. To start the test procedure, go to the Test menu and select Initial Test. Start off by finding their extended range of motion. See how far back into extension they can go, engage the angle selector and flip the switch. Then move them slowly into flexion. Once you find their maximum flexion position, engage the angle selector and flip the switch. Now take them back to top dead center, which is standardized at 24 degrees. Engage the angle selector and flip the switch. The next step is to lock the counterweight at top dead center. Be sure that it's leveled and then lock it securely. To adjust the counterweight, move the patient to their maximum extension angle, which in this case is 0 degrees. Move them to maximum extension, engage the angle selector, and flip the switch. Now, adjust the counterweight, and as you do this, make sure the patient's head is against the head pad and that they're not looking at the monitor. If the torque on the screen is positive, move the counterweight down, and if the torque on the screen is negative, move the counterweight up. Once the counterweight is adjusted, flip the switch to record it and move the patient back to 18 degrees. Then loosen their restraints, first by starting with the thigh restraint, and then loosen the footboard adjustment. Record the counterweight gauge reading into the computer. Record the patient's femur restraint position and their seat pad. Now it's time to set the computer for the warm-up exercise. Go to the test menu, select dynamic, and then determine their exercise weight. Prior to the dynamic exercise, give the patient the appropriate dynamic exercise instructions. This begins by giving them a demonstration of how to perform the exercise, instructing them that they will feel some fatigue on their low back muscles. Remind them to keep a loose grip on the handlebars and not to push into the headrest. Also let them know that they should lift the weight slowly over 2 seconds, pause, and lower slowly over 4 seconds. The weight needs to be entered into the computer and set on the weight stack. Tighten the chain. The recommended starting weight for women is 45 pounds and for men it's 60 pounds. Be sure that the weight in the computer and the weight on the weight stack are the same. Tighten the thigh restraint now to begin the exercise and the footboard adjustment. And be sure to check the restraints. Again, ask the patient to lift their heels off the footboard and to bend forward and touch their toes. To start the dynamic exercise, instruct the patients to hold the handlebars and move them into the flexed position. Engage the angle selector, and then to release the weight stack, move the movement arm lock down and flip the switch. Help the patient start the dynamic exercise by gently holding on to the handlebars. You want to make sure that the patient has control of the exercise weight, especially for the first 2 or 3 repetitions. They should also hear beeps as they perform the exercise in full extension and full flexion. Once you feel that they have control of the weight, you can take your hand off of the handlebar and allow them to perform the exercise on their own. Let them know that they should lift the weight slowly over 2 seconds, pause, and lower slowly over 4 seconds. When the patient is finished, lower the weight slowly, flip the switch to record the exercise session, put the movement arm lock up, and take the patient back to 18 degrees. Now, loosen the restraints, first starting with the thigh restraint, and then loosen the footboard adjustment. Now, go back to the computer and save the dynamic exercise by hitting Enter and returning to the main menu. Instruct the patient on how to perform the practice isometric test. Remind them to keep a loose grip on the handlebars. Instruct the patient to gently push back against the upper back pad, slowly and gently over 3 seconds, pausing for a second and then relaxing for 3 seconds. Then go back to the computer and set up the practice isometric test. Go to Test, select Isometric Options, uncheck Preset, go back to Test, select Isometric Options, uncheck Energy, and finally enter in Practice Isometric Test. Now tighten the restraint, starting with the thigh restraint and then the footboard adjustment. Once the restraints are secure, ask the patient to lift their heels off the footboard and slowly bend forward and touch their toes. The practice isometric test will begin by asking the patient to hold on to the handlebars gently and moving them to the center of their range of motion, which is 36 degrees. Engage the angle selector and flip the switch. The patient should give you a submaximal effort, making sure to exhale as they push into the pad. Gently stretch the patient before you bring them into the flexed position, which is the second test point. Move them to flexion, engage the angle selector, and flip the switch. Again, ask them to give a submaximal effort, and then stretch them one last time, gently moving them back into extension and selecting their extended test position. Once you're back in extension, instruct the patient to push down and back into the corner of the floor. Then bring the patient back to 18 degrees and loosen the restraints. Again, first starting with the thigh restraint and then loosening the footboard. To save the test, hit F2 on the keyboard and then enter and enter one more time to take you back to the main menu. Now it's time to begin the baseline isometric test. Be sure to review the instructions with the patient. In particular, demonstrate for them how they should contract against the back pad during the test procedures. going to the test menu and selecting isometric options, preset, and then typing in the test comments, baseline isometric test. Now return to the patient and tighten the restraints. First start with the thigh restraint and then secure the footboard. Again, watch the pads compress as you secure the footboard, asking the patient to lift their heels off the footboard and bending forward to touch their toes. The baseline isometric test will begin in the flexed position. Bring the patient to the fully flexed position, engage the angle selector, and flip the switch. Instruct the patient to gently push back against the upper back pad. After their contraction, stretch them into the extended position and bring them to the next standardized test position. Once again, engage the angle selector and flip the switch. Instruct the patient to gently build their force back against the pad, reminding them to keep a loose grip on the handlebars and exhaling as they push into the pad. In the middle of the range of motion, tighten the restraints again to make sure you maintain proper stabilization. Then pick up the test at that point by flipping the switch and asking the patient to push back against the back pad. Record their effort by flipping the switch. Be sure to stretch the patient in between each test point slowly and steadily to give them a rest and to let them recover briefly in between their exertions. Move them to the next standardized test point, ask them to exert an effort, and be sure to record their effort by flipping the switch. The last two test positions in extension can be difficult for the patient to perform. Make sure you watch their technique, asking them to keep their head against the head pad as they're pushing into the back pad. These positions can be challenging in regards to the patient's technique. At the last position in full extension, remind the patient to keep their head against the back pad and to push back and down towards the corner of the floor. When you're finished with the test, return the patient to 18 degrees and then loosen the restraints. To save the test, return to the computer and hit enter. Set up the computer to interpret the test results for the patient. Go to the graph menu, select norms, go through and select the appropriate patient and bring up the test grid. As you're doing this, you'll be comparing the patient's effort to their aged and gender-matched norm. Interpret the results for the patient. Explain to them how strong they are in comparison to people who do not have chronic low back pain. Also explain to them what their range of motion looks like in comparison to someone who has a full range of motion. Let the patient know that this is the starting measurement of their strength and that we're going to use this information to create our therapy program.